Now, could we hope to reduce snoring and the more serious symptoms of obstructive sleep apnea with a drug, with a pill? At the moment, the so-called CPAP devices, which apply continuous positive airway pressure, or other oral appliances are typically used. But in a clinical trial, one epilepsy medication has in fact been found to make a difference. The drug is called Saltiem. I think I'm pronouncing it correctly. Lindsay Browning is a sleep expert. Lindsay, first of all, has a pill ever been found to have an effect on snoring or sleep apnea before?
Not yet. The major treatment for snoring with sleep apnea is, like you said, the physical opening and continuous airway pressure to help people breathe by either keeping the airway open by a mandibular device that sort of makes the lower jaw go forward so that you keep the airway open, or with the continuous pressure of air throughout the night to keep that airway open. And of course, sleep apnea is hugely important. It has such devastating effects because if it's untreated, then people's sleep is fragmented. They're continually waking up throughout the night. They have daytime fatigue. They might fall asleep at the wheel. They're so tired, as well as the impact it has on their greater health, like their risk of heart attacks, high blood pressure, weight gain, that kind of thing.
Right. So we've had a trial on this drug. What does it tell us exactly? How effective is it?
Well, this trial was on a small group of people, and it was a sort of a very preliminary thing. So we can't draw huge um, plans for healthcare from it, but it is really exciting that there might be a drug treatment available that is going to help with sleep apnea. Because the trouble with CPAP machines is that some people really don't get on with them. Either they don't fit properly, though they come off in the middle of the night, or people just find them so uncomfortable that they just don't want to sleep with them. And untreated sleep apnea, like I said, is really serious. So if for those people who can't use CPAP machines, there are other alternatives available, and if this drug, which is already used for epilepsy in children, if this drug might be one of several options going forwards, more clinical trials to see about the side effects, see if it really is as effective as this preliminary study suggests, that would be really exciting
Okay.
to help treat more people with sleep apnea.
More research needed, obviously. Look, I was looking up this drug, quite a serious drug, and one with some potentially serious side effects. This has been written up to some extent. Oh, a pill that'll cure snoring. Would you take this drug for something like snoring, which one might put in the inconvenience folder, as opposed to, say, sleep apnea, which can be a lot more serious?
Sure. So people who have sleep apnea tend to snore, but yes, light snoring is quite common. Heavy snoring that really disrupts sleep and leads to sleep apnea is something we need to treat. There is no way we can draw from this drug that it should be used just for general snoring until more trials have happened, until we find out the side effects, until we find if it really is as effective as it suggests. But yes, if people are snoring, they should look at getting it treated. Maybe there are allergies causing the snoring. Maybe it's your sleeping position. If you could sleep on your side instead of on your back, you might reduce the snoring. Or if it's a weight issue, people who lose weight tend to stop snoring as well. So there are lots of things you can do to reduce snoring before jumping to take some kind of drug and thinking that's your only solution.
Lindsay Browning, thank you very much.